Okay, as we ended our last session, I was talking about thrush, which this is the word here, thrush. A lot of times we relate that to the oral cavity. It is a type of candidiasis. We find that in children. We can find it a lot of times in elderly people because children's mouth needs to be brushed or the tissues need to be stimulated. The same thing with the elderly. They need their mouth cleaned daily, remove dentures, have the tissues brushed and cleaned so that with infants, milk and things like that, it's not staying on the tissue. And then with the elderly, that they're not having food between the dentures and the tissues. So the mouth needs to be cleaned, wiped out, and rinsed daily. So looking at different types of candidiasis, again, you have diaper rash, vaginitis, and thrush. Those are different common types of candidiasis. So we can look at this type of candidiasis, pseudomembranous candidiasis, that's thrush. Then we have hyperplastic candidiasis, and then we have atrophic candidiasis. All of these can be treated with nystatin. You wrote a prescription for nystatin in you delivered that in a solution, and you wanted the patient to rinse with it for, I believe it was up to 8 days. So nystatin, that can come in an ointment, but in this case, if it's in the oral cavity, we would want a solution of it. Another way that they treat it is with what they call magic mouthwash. There's 3 ingredients in magic mouthwash. It was discovered at UNC Chapel Hill, and so there's 3 ingredients in that magic mouthwash, so the pharmacist would have to actually mix that. So that would also treat the candidiasis. This is an example of the pseudomembranous candidiasis, or the thrush. And as you see, it's a large red patch. Now, this person does not wear a denture, so we can't blame it on that. I don't really know why this is happening here. Could be long-term antibiotics. They could be a diabetic. So we have to go back to those type things. You see the white area on here? A lot of times this is described as cottage cheese. So if you know what cottage cheese looks like, then you would be able to identify the candidiasis. It's in clumps, it's thick, it's patchy. This is a chronic hyperplastic candidiasis. Now this is a little extreme. Not that it can't happen, but typically you're not going to see this advanced state of it, but it can happen. But if you see the white covering the tongue, and again, it's a yeast infection in the tissue. So don't treat it with antibiotics. It will do it no good. You have to have antifungal medication like the nystatin. And look at the word in that, chronic. Okay, so this is something that this patient tends to have a lot. So, my guess would be maybe a diabetic, someone with a very dry mouth. This is what they may have to deal with. Okay, so going from candidiasis, let's look at the word aphthous ulcers. So aphthous ulcers are also known as aphthous stomatitis or canker sores. And so basically, this is what a lot of people call the, just like they'll typically say, I'll have an ulcer in my mouth, okay? And there's a lot of different speculations as to what causes the ulcer, and we'll talk about that. So you can have recurrent aphthous ulcers, RAU, stands for recurrent aphthous ulcers. It's a disease that causes reoccurring outbreaks of blister-like sores inside the mouth and on the lips. So the aphthous ulcer, a lot of times people may think it's a fever blister, but it's typically more in the mouth than outside. Minor, you can have episodes that occur fewer than 6 times a year. Lesions usually heal within 7 to 10 days. If they're major, you can have outbreaks that are larger, deeper ulcers that take longer to heal, and they can be very painful, especially if someone comes in for dental work. You probably want to postpone that. Okay, the aphthous ulcers are usually related to trauma, toothbrush scratches, maybe damaging, getting in a hurry with the toothbrush and hitting the tissue, may be related to the reuse of water bottles, often respond to antiviral medication, Zovirax, Denavir. The Denavir is very popular right now, so the aphthous ulcers can be, again, in the mouth or on the lips. And this is what you're looking at. This is a minor aphthous ulcer. If you notice, this is a white area, this huge red area of inflammation around it. And again, these will heal in 7 to 10 days. Some people tend to say, oh yeah, I get those when I eat a lot of tomatoes or citrus, lemons, oranges, anything like that. Drink orange juice. So a lot of people think that they get those when they have that type of diet. Stress can also cause them, and trauma. Okay, now here's an aphthous ulcer on the soft palate. If you look back here, you'll see this white area, then you see the red around it. Obviously, this patient probably wears a denture since they are edentulous. So this can be very painful when you are the patient swallowing. They can also be caused by an HVE being causing damage or trauma here when you're suctioning. Be very careful when you're working in people's mouths because you can actually be the trauma that causes these aphthous ulcers. Here's another one. An aphthous ulcer is on the inside of the lip, right here. They can also be caused, maybe you accidentally bite your lip. Sometimes that can create them. Okay, so that's aphthous ulcers. So let's move on to cellulitis. Cellulitis spreads through soft tissues or an organ. It moves rapidly and it is accompanied by a high fever, so it can become very serious very quickly. The skin becomes very red and there's severe throbbing at the inflammation site. Cellulitis is associated with oral infections. It's potentially dangerous because it can travel quickly to sensitive tissues such as the eye or the brain. So this is something that we have to be very, very careful of with cellulitis. Is someone may have an abscessed tooth. They get up and then one morning and maybe this is a large swollen area and it can move very quickly. Okay, so here is a picture of a child that has been hospitalized. Cellulitis, swelling is caused by increased local edema associated with dental infection. The patient was hospitalized for treatment of the swelling. And if you look in this area, you can see how large the swelling is. So that can be very, very dangerous. That's not something that we are going to treat in the dental office. We are going to send them straight to the hospital. If you look at this child probably has one or more abscess teeth. Look at how swollen the eye is here, red, irritated, it's feverish, inflamed. The problem here, the cellulitis can go through to the eye, cause eye damage, but even more serious, it travels upward as it goes into the eye. It can also advance into the brain. So, and this is not something you mess with for a week. This is something that I've seen one case of this and in the dental office, and this child was sent to the ER immediately for treatment for antibiotics. And it's not over-the-counter antibiotics, or oral antibiotics. This is a hospitalization type thing. So cellulitis, it's within the cellular membranes. Okay. So we have some more information on the tongue. We have talked about that before, but let's see what we have new about the tongue. Okay, so here is glossitis. And remember we talked about anytime you have the word glossia, That means the tongue. So glossitis is the general term used to describe inflammation and changes in the topography of the tongue. Filiform, we talked about that. If it's absent from the filiform, we call it a bald tongue. The tongue may be sore, have difficulty eating. Many of these conditions exist as normal for certain individuals. So let's look at this glossitis. If you will look at this area of the tongue here, you can see there are no papillas in there. So that could be sometimes referred to as a bald tongue. It can be red, irritant. Okay. Medium rhomboid glossitis, center-shaped tongue irritation. So it's papilla-free mucosa in the center of the tongue. It can be red, smooth, asymptomatic. The result is a fault in the embryonic development. It can also go back to candidal infections that appear later in life, back to that candidiasis. No significant dental implications or symptoms, or symptoms. So we really have to look at where it's located. Sometimes we know what the issue is, but typically it's nothing related dental-wise. Okay. So here we have the medium rhomboid glossitis, and as you can see, again, there's no filiform papilla there. All right, let's move on to another picture of it. Here is a large area. You can see, again, median, in the middle of the tongue, median. Rhomboid glossitis, inflammation. And I'm sure everyone probably knows that itis on the end of the word means inflammation. So let's look at something called the geographic tongue. This is where the tongue exhibits multiple areas of desquamation or loss of the filiform papilla in different areas. We have smooth areas, and it changes over a period of days or weeks. So it kind of resembles a map. So that's why they call it geographic tongue. So it changes. It may do it, look different day to day, or maybe in a week it will look different. It kind of like it moves around. It has white margins, seems to migrate. It is not a problem, and it needs no treatment. So here's a geographic tongue, and if you look at this, you think, oh, that looks blistered. Well, really, it's not. It's just the tongue up close. But you can see how these areas look through here. We can see that today, and maybe a week from now, it'll be totally different. Look more like a normal tongue. Here's an example of another one. You see these areas here, and here, and in here. Geographic tongue. So that may fill in, not be there, and then there may be other spots, other places in a week or two. Called a geographic tongue, and here we have the same thing. So that's interesting. All right. And again, two more images of a geographic tongue. You can see how it's very small here, and here it's gotten larger. And the diagnosis for this is pretty simple. Look at it in a week from now or 2 weeks from now. See if it's different. See if it's migrated and moved around. Okay, so here we have what we call a scalloped tongue. If you just look at the edges, you see how it kind of goes in and out. Scalloped. Looks a whole lot like to me that this tongue is being depressed upon teeth. This looks like a central incisor here to me. So it looks like this could be caused from just pressure against the teeth. Maybe not, but that's it. It can happen. So a scalloped tongue. Here we have a fissure tongue. A fissure tongue is normal, but it's different. We don't know why it happens, but it could be a deficiency in vitamins, could be chronic trauma. It's on the top of the tongue, and it's just advised to brush it and with a soft toothbrush and keep it clean, because the debris is going to go into these fissures, which could cause bad breath. Okay, I'm going to pick up here in the next section.